Before we get started, this meeting is pre-recorded, but there will be someone in the chat to answer questions along the way. Let's begin. Hi, I'm Kelsey, an account manager with Aesthetic Record.
And hi, I'm Lexi with Lead AR.
Today we'll be walking you through how to successfully chart and check out inside of Aesthetic Record and how that connects with Lead AR. I'll kick it off with looking at our inventory inside of Aesthetic Record. As a provider, you'll add every product that you can use to treat patients. Our example today is Botox. I already have this product added inside of Aesthetic Record. You'll see how it connects when we go to checkout. The important thing to remember is all pricing in the system is set up under inventory, and you'll see how we walk through that checkout process in just a second. So now I'm looking at the app. I'm inside of my patient's procedure. I've already charted the units of Botox that we just saw added inside of Aesthetic Record. From here, charting my 20 units, I'll click the credit card icon here at the top right. Because I charted my units, Botox is pulling through to our checkout screen. So it's important to document what product you're using and how many units you treated that patient with. I simply click checkout here at the bottom right. At this point, you select the payment method of choice for your patient. As you see here, I've checked out my patient. You have the choice to email the receipt or hit no thanks. Now, how does that connect with Lead AR? If I successfully chart and check out my patient with Botox, what can I set up in the system?
Kelsey, that's a great question. Now that we're going to go back into the computer, I'm going to show why that is important to check out a patient properly in Aesthetic Record and why it's important for Lead AR. So for Lead AR, it's based on tagging, which is based on the product that's on the invoice. So as you can see in this automation, we have a Botox automation. And you might be wondering, why is that important? I think this is very important just so you can follow up with your patients and track things for future events and things like that. So the way that this automation is set up is that the trigger is going to be Botox, Xeomin, and Dysport, which is what the products you would choose in Aesthetic Record at the time of checkout. So the way this is set up is that they get tagged, and then it's a 2-week wait period. Then they're going to follow up with them using an SMS, just checking in on them to see how they're feeling after their treatment. Then we're going to remove the Botox tag.
Why is it important to remove the Botox tag?
Removing the Botox tag and adding the Botox patient tag is super important because it allows new clients to come into this automation. Meaning, if you wanted to track to see if they are an existing patient or keep track of your Botox patients that have come in for the past year, that means that they can still fall back into this automation even if they're coming for their second treatment and they're not a first-time patient. Now that we've added that Botox patient tag, you might be wondering how that comes into play. So if you click on your Contacts tab in Lead AR, you can create different kinds of smart lists based on tags, which is also another reason of why tagging is so important. So to create a smart list based on a tag, you can navigate over to More Filters, and then if you scroll down, you see that you can select Tag. Now that we've created that Botox patient tag, we are going to type in Botox patient, and then click Apply. So now you can save this as a smart list as Botox patient. Now that you've created this smart list in Lead AR, anytime that somebody's going to get that Botox patient tag, they're going to come over and just keep falling into this list. So this is a great way that you can track all of your patients that come in for Botox every 3 months, every 6 months, every year, and maybe invite them to a Botox party, or maybe you want to send them a mass SMS or an email. This is just a great way to categorize your patients and maximize the use of Lead AR. You might be wondering, what if I use Botox for multiple areas of the face, such as a lip flip? Kelsey, how would I check that out in Aesthetic Record?
In Aesthetic Record, it's important to add pricing variations. If I click into pricing variation and I search for our example lip flip, clicking edit here at the far right, this allows the provider to select the product that they're using for that treatment. But in connection to Lead AR, you can name the pricing variation exactly what the tag is inside of Lead AR. And that's where successfully checking out your patient with this variation comes into play. We're going to go ahead and switch over to the Aesthetic Record app and walk through what that process looks like. Now that we saw the pricing variation in aesthetic record named lip flip, when it comes to charting as a provider, if I click into my procedure timeline and I click into this pencil, I'm going to select plus product at the top left. Pricing variation is located on this second tab right in the middle. I'm going to go ahead and select lip flip for this example. If I click on my service bucket at the top left, this will drop down every product that you can use for this lip flip. And that's important because as a provider, you want to track what you actually use per patient because it can be different for Kelsey versus Lexi. I can have Dysport while Lexi needed Botox. If I select Botox in this example and select my units, I'm going to zoom into the patient face and just apply a few. If I click Save at the top right, the checkout process is the same. As long as I apply the lip flip pricing variation, it's going to pull through at the checkout screen. So when I click on the credit card icon, because we created that pricing variation, lip flip is going to talk to LeadAR as soon as we check out this invoice. It's important to finalize the invoice and document just like this so the tag comes into action. Once I click checkout at the bottom right, same process, close out the invoice, select the payment method as I mentioned earlier. I'll use cash, click charge, email the receipt, and because that invoice is finalized, we can now see how automations come into play for LeadAR.
Now that we're back on the computer, I'm going to go into this lip flip automation and show you why it was so important that you selected that pricing variation at the time of checkout. This automation is set up very similar to the Botox one. The trigger is lip flip because it's based off of the invoice. So now that the lip flip is tagged, this is going to be set up the exact same way. Wait a couple of weeks and you can customize this as much as you want. And if you have questions building out automations, you can email info@myleadar.com and schedule a call with us. But going forward, this automation is set up the exact same way as the Botox ones, but this one is for lip flip. So let's say that you didn't check them out how Kelsey explained to you in aesthetic record. What would happen is that your lip flip patients would fall into your Botox automation, which is something that you don't want, and you want to be able to separate your patients. Now that we're back on the computer, I'm going to show you what the lip flip automation would look like. So whenever you're going into LeadAR, the trigger is going to be lip flip. And you might ask why. Because Kelsey chose the pricing variation for lip flip, that is how the tag is going to fall into this automation. So this automation is set up very similar to the Botox one, but now you have a way to track your lip flip patients while also tracking your Botox patients.
That concludes how to successfully chart and check out your patient and how it connects to LeadAR.
If you have any other questions, please email us at info@myleadar.com and we'll see you next time.